Let's just call Bryan Steil right now. Hello, Representative Steil. It's LuAnn Bird calling from Hales Corners again. I'm here with about 50 of your constituents, and we are calling collectively to tell you that we really need you to stand up for health care. We want you to make sure we are all funded. Please make sure you stand up to Trump, stand up to your party even, and make sure that you take care of constituents over billionaires. Thank you.
It is a perfect call.
And said, we got to talk about health care. We knew that open enrollment was happening on November 1st. We knew that people were going to be opening their inbox and they were going to be seeing increases of double, triple, and maybe even more, and they're going to be losing their benefits. So we wanted to provide a place here where people could come and tell their stories.
Thank you, LuAnn, for setting this up. I look around this room and I see so many faces that have been in this fight for so long, and I want to thank you for every month after month, week after week, day after day, every protest, every event. You're out there fighting. You're not slowing down, and that's what we need. You know, when somebody asked me, what I was going to talk about, and I said, well, this really doesn't affect me personally, but it affects people I know. It affects my friends, my neighbors, family members. So that's what we need to do. We need to watch out for our friends, our neighbors, and family members. If they need help, reach out to them. The other day I said, we don't know what's going on in our neighbors' homes. We don't know if they're struggling. Take a minute to talk to your neighbors and your friends. See if they need help. First it's the SNAP benefits, and supposedly they're going to pay part of them. Yeah, we don't know how much. And then it's the ACA. You remember when the ACA first became law? It really was a lifeline for a lot of people. It kept people from having to file for medical bankruptcy. People were able to get their health care. Children were able to get their health care. Parents were able to put food on their table without worrying about health care. And if we don't fight to keep that, I really worry about what is going to happen in this country. I really worry about what's going to happen to people sitting right here in this room. So whether or not you're fighting for yourself or you're fighting for your family or your neighbors or your friends, keep up the fight. Keep up the fight. That's what we all need to do. LuAnn said that, the powerful people are here, people that can do something. This is really a federal issue. And those of us on the state level, we don't have a vote on this, but what we have is our voice and your voice. And I can promise you that the Democrats in the state legislature are going to continue to stand right by you and fight this, because what they're doing is ruining our country, ruining our communities, ruining our homes, ruining our families. And we can't let this happen. Thank you.
All right.
So Ryan Clancy, I'm the state representative for District 19, and I have a little behind-the-scenes knowledge for you here. So as it turns out, sometimes Republicans aren't quite the same behind closed doors as they are in public, right? Bryan Steil, the good news is that he is exactly the same behind the scenes as he is in public, and he is absolutely terrible in both places. But he says what he means. And he has jumped into this with both feet. I mean, whether it's his votes and action on, ending SNAP benefits, ending food share for folks, the 250,000 folks across Wisconsin who depend on food share to feed their families, or whether it's attacking ACA and taking, a 250,000 people across the state off of their current existing health insurance and making it almost unaffordable for tens of thousands more. Steil is right there. He's lying about it. He talks about protecting families while he's working to end access to health insurance. He talks about strengthening the ACA when he knows that his votes and his action will kick so many people off of what they have right now. And here's the facts. A couple over age 60 could see their ACA premiums rise by $33,000 a year. So raise your hand if you have an extra $33,000 in disposal. Oh, I saw one and it was no. Okay. Right? Okay, good. Insurance is on Sinicki then, so come see her afterwards if you can't afford this like the rest of us. But the good news is this, right? It's very clear that folks all across the state are not putting up with this anymore. Whether it's in La Crosse, whether it's very small towns in rural Wisconsin. I was just in Rose Lake a few months ago. And it's not just Democrats, right? It's folks all across the political spectrum. It's socialists, it's Republicans, it's Democrats, it's independents. People are angry and they are scared and they're pushing back on this. And as terrifying as it is to look around and see that your neighbors and your friends and your community may not have access to food or health care soon, this is also mobilizing a lot of folks. And that's why I'm so grateful that you're showing up here. I get that Democrats don't always get everything right? Sometimes we fail to fight for communities when we need it. And the ACA was not perfect. Right? The Affordable Care Act should have been health care for everybody. It should have been single payer, right? And yet the ACA has saved lives. It's kept millions of people across the US from not having insurance at all. I was one of the many people during the pandemic that did not have any health insurance for myself or my family, and that was terrifying. And nobody should have to go through that. We were lucky. We were one of the folks who didn't get sick. I didn't go headlong into medical debt that I couldn't recover from. But many people in the United States do when they don't have health insurance. And the ACA is keeping them from the worst, it's the safety net on the very bottom. And it's used by a ton of folks here in Wisconsin as it is across the US. But in this case, Dems have it right? They have put a line in the sand and they said, no, we're not going to sell us out on health care, and we should be standing with the Democrats in this case. Yeah. This is a fight worth having, and thank you for being here for it. Yeah. All right.
Thank you. Thank you to my two representatives and to LuAnn Bird, wherever she went, for helping to put this together, and to Dave Weingrod for helping rope us all in here at Cudahy Library. Shout out to our libraries, which we still have. I was thinking, I'm just like the number of things, and I look around this room at the people who are showing up, who continue to show up, and are getting really good at making the protest signs that are seeing behind us. But I'm also seeing the people who don't want to be here. I think of Erin, who continues to show up and has been calling my office for the last 8 months because she is working with her mom. She is doing her best to try and balance and make sure that she is being the best citizen that she can be in our community, and explaining to me in very real terms of what losing assistance will mean to her, what the additional paperwork requirements will mean when she no longer has access to food and health care, and what the real outcome of that is. And hearing her plead that with my staff on a regular basis, but then also sitting down with me. And the question that she can't get answered is why Bryan Steil won't pick up the phone to be able to hear her case. Why will Ron Johnson not pick up his phone or meet her at the office to be able to see who she is and to explain the problems of this? And I think the answer is truly heartbreaking, which is that they don't care. They really don't care. They look down their noses. I saw a report this morning where Ron Johnson was talking to somebody on his propaganda channel, Fox News, and he just said, like, all of these people are refusing to work, And that's it. We have created a safety net that's just a hammock for these lazy folks. And you knew that he had never met Erin, that he had never met anybody like Erin, and the thousands of people out there who are not wanting a handout. They just want the basic understanding, the basic ground level of what we should expect in a society, which is that people shouldn't have to starve to death. Full stop. We shouldn't have people starving to death in the richest country on the planet. Full stop. We shouldn't have people going into bankruptcy because they get sick, something that is unpreventable. We're all human here, right? I believe this is the one rare time where we're not online, where you don't know who is commenting and whether they're a bot or not. We're all human here, and we all get sick, and we deserve the dignity of care without having to walk through there, without having somebody make sure that you have health insurance to be able to decide what kind of care that you are going to get, and be able to make sure that there is a payment up front, or that you have a card that says that there will be payment due before you get the care that you need. And unfortunately, we have lost sight of that. I am continuing to fight for that. I know Representative Clancy and Representative Sinicki are continuing to fight for that. But Bryan Steil is not. Ron Johnson is not. And what really is heartbreaking is to know that not only are they refusing to meet individually, they're refusing to just do this, which is just to stand in front of people and have a town hall and to hear a back and forth about what that is that they're doing. And worse than that, right now, Bryan Steil is on week 5 of a government-funded vacation, where they are adjourned out to the point where they're not even swearing in a duly elected U.S. representative from Arizona who doesn't have an office, doesn't have an account, doesn't even have a phone assigned to her, because they're refusing to swear her in for an unprecedented 5 weeks. And at that same time, Bryan Steil has held one listening session for the entirety of the Trump administration, and for that he got a front page story in the Journal-Sentinel for kudos of saying, oh, isn't it great that even in this environment Bryan Steil's willing to show up. What are our expectations, right? You do not, and in a democracy, you do not get to govern without the consent of the governed. He does not have the consent of the governed, right? The signs show it. The fact that people are continuing to show up repeatedly at the No Kings rallies, here today, out in front of his office, regularly calling him, he does not have the consent of the governed. And this is an unsustainable trajectory that we are on, where they are putting money together to be able to fund ICE agents, to be able to break families apart, to be able to unconstitutionally break down doors and to detain people without due process, and to break up protests. And at the same time, they're refusing to fund the basics that we should expect as a society of food and health care and beyond. So I am glad that you guys are out here. I'm privileged to be in a room of such heroes who are taking the time to be here. Shout out to, I saw the folks from Project Concern earlier. I mean, they might be already back at work. There he is. Hey, Dick. The folks at Project Concern and the other folks from the community centers that are stepping up. And I am really glad. We did a press conference last week, and Dick was telling me that they received $7,000 in donations since then, and a regular flow of people coming in. Yeah, just yesterday. Just fantastic. That's good. I'm glad somebody showed up besides the Packers yesterday. But yeah, no, it's the people are showing up. We are showing what kind of a community that we are, but it shouldn't be that, right? Frankly, that is the role of what government is supposed to be, is supposed to collectively act to make sure that we are all better off. That's it. And this idea that it is just shoveling money to the richest of the rich while Trump is able to build a gaudy Ramada Inn style ballroom while tearing down our history, and at the same time travel around the world, give pardons to billionaires who are lining his pockets. Right. And this, I would rather not even picture what was happening at his great, throwing parties, right? While the rest of us are suffering. Anybody that goes into public service, our two representatives here, myself included, and I know that there are other recently elected folks in the office out here, and you have to love people. You really do, if this is going to work in a democracy. And unfortunately, we have people in office who don't. They really don't. And that is an impassable experience that we have, and the more that we can show up and demand the best of us is represented by our leaders at every single level, and that will not change, especially as they try and tell us that we have no power and try and strip that away from us. There is no way. As much as they try to sic the military and to scare us and to strike fear into the hearts of all Americans, they would do well to study history and recognize that Americans don't back down, and that you cannot scare us into submission, and that is not a country that we recognize. So as we stand up for our most vulnerable neighbors here today, and we stand up and say Bryan Steil needs to show up for work, we are going to continue to make sure that we are not fearful in this time, that we are stalwart, and that we are going to get through this stronger than ever. It's a dark time, but I feel the light shining from all of you who are here today. So thank you for continuing to shine beacons of hope for everybody in our community.
Thank you. We put these signs to work every Saturday on the corner of 76th and Layton, and I see a lot of my protester friends who stood out even in the rain and cold. But I was quite impressed when JoAnn shows up, and she shows up every week. And then she told me this week of her healthcare challenge. Do you want to stand up or do you want to sit there? Okay, come on up.
Yeah. Okay. I'm not a professional. So, thank you. Yeah. And when I saw him use his phone, I thought I could have done that. put my notes on a phone instead. I did it the old-fashioned way, so thank you, LuAnn, for letting me tell my story. A few days before, my GoodRx program was to be renewed, which was the first. I don't know how many of you use GoodRx for your prescriptions. I have for about 25, 30 years used them, and I've always been pleased. I saved $350. I have very few prescriptions, and they're not expensive. As a matter of fact, one of them for my heart is free. But the program was I got a text saying the metro market, which is where I have it, is no longer honoring GoodRx programs. They're cutting the GoodRx. I know, I since have found out, because I panicked, and I since have found out that you can get it through Walgreens and other stores, and no information where to go. We're just canceling it. And I've had this program, like I said, for over 20 years. And I've always been happy with it. But then I found out about Walgreens. So I went over there, and they were not very helpful. They said, you have to send your prescriptions the doctor has to send us your prescriptions. So, okay, that's understandable. But they gave me no real encouragement, and I have very cheap prescriptions, but on my budget, it makes a difference. And so I think I said last year they said GoodRx saved me over $350. But when I went to it, and then Walgreens gave me, the problem also is I was out of heart medication. They couldn't help me. So I called the doctor, and at this point, when I was writing this, there was no response, but she did call this morning, and she did help me out. She did some research for me at the different places where GoodRx does continue. What shocked me is the coldness and the callousness that they just said, we're not serving you any longer, with no help as to where to go. So the morning I met with LuAnn, or the evening, I just got the message, so I kind of panicked. But so anyway, I just wanted to tell you about the program, how they cancel it just off the top of I guess, I don't know. It may have been in the works for them, but they didn't tell me about it, and I panicked. But I'm working it out, and I'm trying not to complain about it. I just say it's frustration, but patience. Frustration, but patience. We got to work it out. So anyway, thanks, LuAnn.
We'll take care of you, JoAnn. Don't worry, we care. We're here to show you we care. Then I go to Bryan Steil's office on Wednesdays at 2, and I meet Erin. Erin shows up every week, right? Just about. Most every week to tell her story. So I'd like to introduce Erin.
I'm going to be talking about Medicaid instead of the ACA. Let's see. I'm just not sure what this big, beautiful bill is going to mean for the people I love. Right now I'm reading a story of my best friend, Emma. We've been best friends since we were in the 2nd grade. We were Snow White and Rose Red in the school play, and her mom made us dresses. We laughed together in school assemblies, and no matter how far we've gone, we've always come back to each other somehow. She lives in a duplex above, in the duplex above with her parents. They live in the apartment below, within walking distance to a park. She does not work, but occasionally volunteers their art schools to the Grand Avenue Club. Medicaid makes it possible for her to afford her medications and medical appointments, such as their GP, their psychiatrist, sorry, it's in small print, their dentist. Probably should put this down. Medicaid is the reason why they're functioning as well as they are, despite anxiety and schizophrenia. Really, people with mental illnesses are just regular people, like anybody else. We go out in the community and nobody knows either of our diagnoses. Both of us have invisible disabilities. Without Medicaid, they would run the risk of destabilization and homelessness. Currently, prescription drugs and home and community-based services. Just for context, home and community-based services is more like what you'd find in Good Housekeeping magazine than medical care. It's independent living skills, things like cooking healthy meals or knowing how to clean up the house. Currently, prescription drugs are a optional service. You're not required to pay for medications. And honestly, it's already difficult enough for her to get her antipsychotic medications that help keep her hallucinations in check. Depending on what changes we see in this big, beautiful bill, there is a very good chance that services that help keep her apartment sanitary will stop. I have so many questions about how this is going to work. What counts as a disabling mental disorder? How do they prove they're going to be exempt because of a disability? How many hours of care would her mother, an unpaid family caregiver, by the way, who also uses Medicaid, how many hours of care would they have to do in order to be exempt? Honestly, I don't quite understand how this can be a Republican thing or a Democrat thing. Honestly, as far as I know, everybody's got a best friend. So I've just got so many questions. What is this bill going to mean?
Has Bryan Steil been responsive to you? I know you're there all the time. Has he been responsive?
I've never heard from the representative himself. His aides seem very nice. A one in-person meeting is a good start, but we need to be in constant dialogue with constituents. And really, it's all this stuff is not really a Democrat thing or a Republican thing. It's just an everybody thing. Yeah, basically.
Thank you, Erin. Thank you again. Thank you, Erin. And I have another friend, Donna, who's ready to speak. Or, either way, Donna.
Doug, would you like to go?
I'm sure.
Dog is coming up next.
I'll go first. My name is Doug Perry. I'm a South Milwaukee resident. I'm a retired teacher and active in the community. I was on a school board in South Milwaukee for 9 years, and just active in the community, blah, blah, blah. Wow, what some stories already. And we've just heard from a couple of people. Gut-wrenching. Mine's going to be a little more selfish to start with. So I'm on Medicare. I'm an old guy. My wife is a little bit younger than I, so she's in the ACA. And currently, with the subsidies, she pays, in 2025, she was paying $422 a month. And that is $8,000 deductible and co-pays. But you have to have health insurance, right? So she's been looking, as Representative Sinicki said, November 1st. Enrollment period's open. Similar coverage, not exactly the same. First of all, Common Ground, who she was insured with the last 2 years, they're gone. They pulled out of Milwaukee County. They're not making enough money in several counties in Wisconsin, so they're gone. So she has a choice between UHC and Anthem Blue Shield, and her rates will go up without the subsidies. Will go up to $1,167 a month. Now, we're not poor, but we're not wealthy either. We're on a fixed income. We get a little bit from Social Security that is for the cost of living. I think it's going to be 2.8%. But basically, we're on a fixed income. Fortunately, we have a home that's paid for, so our living expenses are low. But that's going to just blow a hole in our budget. Absolutely blow a hole in our budget. We're going to have to dip into our savings. There's no two ways about it. Because we have to. And as someone stated earlier, and I don't know who it was, but someone, when you go to the ACA and you look for a plan, it's based on your age. So my wife is in her 60s, so she pays elevated rate, obviously. The older we get, the more of a risk we are, of course. But we'll have to do it, and we'll have to pay for that. But in the short term, we have to stick by what, I think Ryan said it well, we have to stick and support the Democrats. They can't back down on this. They can't back down on this. We need these subsidies. However, that's in the short run. Who gets these subsidies? Insurance companies. So we're asking the government for these subsidies, which we absolutely have to have. We have to have these subsidies to survive day to day. But they go to the insurance companies. And in the system that we're in, and I see healthcare, I love it. It's not healthcare. It's health insurance. It is. It's not healthcare. It's health insurance. And in this system, there's no incentive to keep people healthy. There's no incentive to keep people healthy. The only incentive is to collect premiums. That's the only incentive. So somewhere along the line, we have to remember, we have to continue this fight. We have to stay on the ground and do what we need to do to get these subsidies, to save Medicaid, what we can of Medicaid, to restore it and increase it. But at the same time, we have to remember there's a bigger picture here. In Sweden, everybody in Sweden pays 7% of their income for health care, not health insurance, for health care. We need, when we're through with this mess, and this will not last forever. This will not last forever. This too shall pass. And when it's over, we have to get better. Single payer, if that's what you want to call it. Medicare for all, whatever you want to call it, that is the only solution to this long term. Thank you for putting this together. Thank you, everyone.
Okay, next up, Donna.
Ryan Clancy. I am that 60-year-old. I don't have the extra 30,000. And Doug, 33 years at South Milwaukee. Thank you for your service. There. Anyway, reconnect. Hi, I am Donna Kyler, and I'm here to speak out. 2 years ago, I retired and had my first encounter with the ACA marketplace. This year, my premium actually decreased for about $412 a month using the premium tax credit adjustment. I have a low-level bronze plan, no prescription meds, and about a $9,000 deductible. The premium tax credit is a subsidy for those making under 400% poverty, and that covers half of what would be an $825 a month premium. My spouse, who is 8 years older than I, is on Medicare. 2 weeks ago, I received a notice from my insurer that read, changes to subsidies may impact premiums for all ACA Marketplace members, even if policyholders keep the same plan. When I logged in this last week, I found that my premium increased from about $825 a month to $1,135 a month. I made sure I got the numbers right. $310 more a month for the same policy, but now with a $10,000 plus deductible. The premium tax credit is still in the system of the ACA marketplace. The enhanced premium tax credits have not been extended. In 2026, my spouse and I will need to pull money from our IRA to cover rising costs and to complete a needed home improvement. With this increase in income, we will go off the $84,500 subsidy cliff. Without that extension of enhanced premium tax credits, I will receive no subsidy, and for $13,620 a year, I will be on that low-level plan, that $10,000 plus deductible. This is my not-so-remarkable story. I'm that 60-year-old, but I'm only one. I don't have a spouse who needs the ACA marketplace, so half that. To Bryan Steil. Who do you work for? How are you benefiting? You betray your oath to the Constitution and to the people you serve. You're supposed to serve. You advocated for and you voted to cut health care, to cut education, to cut SNAP, and voted to upend Medicaid. And you voted for us to pay for indefinite trillion-dollar Trump tax cuts for the rich. You and Trump loyalists continue to move wealth and power from the hands of the many to the hands of the rich, cruel, and oppressive few. We resist your betrayal with our voices, and we will vote you out as soon as we can. And with Doug, I'm with Doug. To those who believe government should work for the people, together we can have single-payer health care. We can invest in our future and support child care and education, and we can't have zero hunger and no poverty in this nation and in this world. To protect our constitutional democracy, we need to get billionaires out of our government. And to reduce inequality and increase our prosperity, it's time again to tax the rich.
How did we get here, right? Here's a bird's eye view of how we got here. And that is, when I saw the cuts that were coming down from the first couple of months this year, I thought, well, I can't sit on the sidelines. I decided to start following that budget process in DC very closely. And I was alarmed to see the priorities that were being put in the budget. And I was even there and talked to my Representative Bryan Steil about what they were doing, and he gave me the direct, well, we can get rid of a lot of fraud, waste, and abuse, and we can rearrange those dollars. What he wouldn't admit is that he wanted to do that so that he could lower the tax rate for the wealthiest, the billionaires, the large corporations, and that's how it works. And by the time they got done with this budget, the spending was still off the charts. As time has gone on, you see the reality of ICE and their investment in helicopters that would fly into Chicago and zip tie children. And this is what they're doing. They're looking for a space for hundreds of, offices right here in Milwaukee. That's what their priorities were. Lower the tax rate for the wealthy, right? And the way we're going to find that money is we're going to just dive right in there and get rid of all this fraud, waste, and abuse. Well, then I started asking my aides. Most of you know I have a paralyzed husband who's completely bedbound, and I have all these aides that come in, and I started asking them, what kind of health care do you have? And that's when I found out that they are all low-income, hardworking people who do not want to work full-time. They have children or they have elderly parents that they care for, and they take care of my husband. So that's when I really got alarmed and, again, realized we got to start telling their stories. And I think that's what it's going to take to change things. And that's, again, why all of you are here, so that we can tell your stories or tell stories of people you know. Like Olivia got notice last week that she was going to lose her SNAP benefits. And she was devastated because that's a big chunk of her living. And that's how she takes care of her daughter and makes sure they have food in their house. So I said to Olivia, why don't you show up? Why don't you come to this press conference? And so she and her daughter were there Friday to talk about SNAP benefits, right? And she was telling what it's like. And the next day I asked her daughter, I asked Royal, her daughter, what did it feel like to be in that press conference? And she said to me, brave. So if they can be brave, we can be brave.
I'm Debbie. I used to be the manager of the local food pantry, and I think it's very important for the clients that I serve that they are able to get insurance. And for myself, as someone getting Social Security, Medicare, they're decreasing health care for regular people, if they're decreasing for these people, then they're coming for Social Security too. So that's why I'm here. As someone who's worked all their life and paid into Social Security, and I was counting on Social Security and Medicare, so any decreases that might come along would affect us. And that's why I'm here. And also for people who receive food stamps. I know what it's like for people that are on food stamps, how hard they work, how difficult it is to get food stamps, and everybody deserves to eat.
My story is a little bit different. My story is what we're going to do to win. Because it doesn't matter, we can sit here all day long. The guy doesn't even show up. He could care less. And we go home, and we might go to one place or another, but we're not going to win. And we're coming to something in the road in terms of health care that we know is coming down the road. And that's all set up by the Republicans to take away health care from the vast amount of people. Not take it away entirely, but making it so much expensive that people can't even use it. And so we can't sit here and say, you know, the stories are great. We should get them all over the place. But we got to figure out what we're going to do. Because otherwise it doesn't matter. I've been working at this 65 years, working on issues. I don't know what the hell I was doing, but bus drivers, I don't know what the hell. Anyway, but now what we've tried to do is we put together a team of people. A team of people, but because it's not going to happen unless we have people from all over the areas. Unless we have young people and old people and people who can, you know, go out. So we did an experiment, and I'll try to make this shorter or a little bit longer. But what we tried to do was bring people together. And bring people together who we knew not only knew the issues, but wanted to fight. Wanted to do something about it. Wanted not to sit and just, you know, be sorry for ourselves. And so the first day we had a meeting of about 30 people, 35 people. People we thought were going to be organizers or people who've worked on projects or people who just wanted to fight. And then after that, we had a meeting of people from all over Milwaukee. And we had 350 people came. And you know what they said? They didn't say, "Oh, that's the greatest speech I ever heard," or clap. They did a lot of that, and I worked with Reverend Lewis, and they can talk forever. Don't tell them I said that, but what they came, the one reason they came and they liked to come was because they wanted to be in the fight. That you can't do it by yourself. Otherwise, you're just wasting time. And so the next thing we did a program with Gwen Moore. And we had, I don't know, maybe 100 people, 75 people. But we did it, and it was over the issues that she has been a champion of, you know, about health care. And so now we're coming to the point where we want other people to come in. We're having a meeting. I can get it to people when we have the meeting. And we're going to discuss how we can go from there. And it's not going to be easy because none of us have a lot of money to spend. We're not going to outspend then. We do have funds to do it. But again, it's something that we just have to do. Because otherwise, what's the point? And I think there's a real chance. I mean, we're 10-1. I mean, when I read those, I don't know if you read all those silly papers on TV. I read both of them, a bunch of them, just stupidly, because they say the same thing over and over and over again. But I think this is a chance. At least we've got to take the chance. And healthcare is an issue that we can take a chance of. We can try to win this first issue, but we're also going to get to healthcare. And healthcare's got to be taken not on by our experts, not on by everybody who can talk better and talk, even if we're this man, who's a really good talker. But this has got to be taken on by a bunch of us. This has got to be the way we got to do it.
I just have one point I want to make, but I want to quick tell my story before I make that point. I'm one of the caregivers for someone who had a very serious accident right before he retired. After 3 months in the hospital and numerous surgeries, he was left with cognitive and physical disabilities and no money. He had spent on every penny he had saved for retirement. So he now was eligible to go for Medicaid and to go into a nursing home. Instead, he joined the family care program, which is a state of Wisconsin program, which is funded by Medicaid, which helps him to live in the community. But with the $1 trillion worth of cuts coming to Medicaid, there's a high likelihood that that program will cut or even disappear, and then he heads to a nursing home. And when I ask myself, what is the sense behind this? I mean, it doesn't make economic sense. It's way more expensive to be in a nursing home. I can only conclude that it's just basic cruelty. But the point I want to make is we've been talking about the federal level, and these cuts are all going to filter down to the state, and it's going to be our state representatives who have to grapple with how this all plays out. I'm lucky that both of my representatives are here tonight, but please don't forget the state of Wisconsin. It's as important as the federal level, and it's going to probably be even more in the future.
My name is Dale Nook. I'm the head of Swing Left Milwaukee, and I want to talk about a personal story and then what informs me and my group right now. So when I was younger, I went into the projects at 5 years old. My mom took care of me with Medicare. I probably would be in a wheelchair, except my mom went and found the best orthopedic surgeon in Milwaukee to operate on both my knees under Medicare. Otherwise, my option would have been go to the county hospital, and I'd probably be in a wheelchair right now. So at 17 years old, I said, I don't want any more help, and this is what Republicans don't understand. People don't want to help. They don't want help. They don't want to be on help, but as soon as they can be off help, they are. So at 17, I got a full-time job at the Postal Service and supported myself, educated myself. Fast forward to now, this is why I work so hard in the community. My group, Swing Left, is focusing on winnable congressional districts. The 3rd district in Wisconsin and the 1st district in Wisconsin. And people from blue states all over the country phone bank, write letters, come up on buses, and they all focus on those targeted seats that we can flip. And the other thing we want to do is take the assembly back at the state. And everybody's helping. We got a great candidate to flip the 21st Assembly District. We made some changes in how the county assigns, and the Bayview team now has the rest of Bayview and the Garden District on our team, and we're going to flip that 21st Assembly seat. If I have to kill myself, we are going to flip that seat. And hopefully we're going to flip the 3rd congressional seat, and we're going to flip the 1st congressional seat, and we're going to get thousands of people from Illinois again to help us. So thank you.
Dave's going to close us out, but there's a lot of things we can do, like phone calls, rallies, organizing, all this stuff. I just want you to know what Birds in a Wire does. Crazy stuff. We did our performance review of Bryan Steil. Characteristics, shows up, fail, meets with voters, consistently fail, incorporates feedback, fail, speaks the truth, fail, works well with others, fail, stands by his oath to democracy and the Constitution, fail. So we delivered this to his office, along with his pink slip, notice of termination. It goes right along with what you said, Dale. We are going to, for loss of health care, ending food assistance, undermining democracy, funding billionaires, supporting aid and funding ICE. We the people feel you are not doing your job, go home. Yeah. So with that, thank you all for coming. Your stories are going to be part of the change. We're going to amplify this. So thank you.
Yeah, thank you all for coming. We set it up to end at 5, and so for the library's purpose, we need to be somewhere out of there here by 5. We're all angry. I'm angry. I think everybody should be angry. There's a lot of things that this administration is doing to make us angry, and one of the worst, of course, is this healthcare thing, right? Taking away healthcare from 15 million people, it's like unbelievable. We talk to people maybe who live in other countries. They can't believe it. They already think our system sucks. And this is going to make it much worse for a lot of people. So as Bruce was saying, we got to do something about it. I'm not coming up here to give you all the answers, but there's a couple things that I think are useful. And it has to do with contacting Steil. He has to keep hearing from people about why he needs to change his vote and why he needs to get his colleagues in the Congress to change their votes about how we're handling health care. So what does that mean? Two things you can do. One is call him, call his office, leave a message. Second of all, on Wednesdays from 2 to 4, over at St. Francis City Hall, his aides have hours there, and you can go in there and relay whatever you want to his aides, and I think he's got to feel the heat.
My name is Carol Limbauch, and this is my granddaughter, Chelsea Turk. She's cognitively disabled and has autism. We live here in St. Francis. My daughter is disabled with multiple autoimmune and other physical diseases and mobility challenges. So, of course, they both need Medicaid. They need that. To that end, I bought us a 2-family house in St. Francis, not to be a landlord, but to provide housing and be there to help each one of them. And my daughter's 46, and I am very fearful of the future for her. I'll be 73 in a minute, and I'm appalled at the direction this country is going, and it's wrong. All of us need to take action. This doesn't affect you, it affects somebody that you know. Perhaps they haven't told you. But the future is at stake here. So not only it's the need for health care, affordable, ACA, prefer single payer in the future, it's also food. The government shutdown is the Republicans' fault for failing to negotiate with the Democrats who are holding out for health care for everybody. Call your representatives, call them often, hold their feet to the fire, talk to your neighbor, use your connections. You can email, you can telephone, do something. It's unethical, unconstitutional, immoral, dead wrong, and people's lives are at risk here.